Now, aesthetic rhinoplasty is something that we have 5 or 7 day conferences on. So in the short period of time, we'll just talk about a few of the issues which I think are most commonly asked about in my practice. One is the dorsal hump, or the bump on the nose, and that's one of the most common reasons why folks will come in for a straight cosmetic rhinoplasty. And it seems like it ought to be a pretty simple thing to do, right? You just go in there and shave a little something off and you send them on their way. It's actually a little bit more complicated than that. And if you think about the structure underneath, so this is the same patient I showed you earlier, there's this outline of this bony cartilaginous septum here, which is in large part causing this bump. So these nasal bones and the septum are over-projecting a little bit. And we actually, with a rhinoplasty, can go in and bring that down by a few millimeters. And that's shown here by this red bar. So we brought this down by a few millimeters here. Again, it seems like it ought to be pretty simple to do. But when you do one thing, it affects more than just that one thing. And so when you take the top down, if you look at it from the front, you see that you actually create sort of what we call an open roof deformity of the nose, or basically a hole looking directly into the nose. And you can't just let somebody walk out of there with something like that because it'll look funny. And so we need to do something to close this. And what we need to do in that case is actually cut the bones on the sides in a precise fashion and move them inwards to close that. And this is why often people get a little bit black and blue after a rhinoplasty where the top is taken down. And these so-called osteotomies of the nose are one of the more complex things that we do in rhinoplasty surgery, and perhaps take some of the most experience. The reason is because we're actually not seeing what we're doing directly. We're doing it sort of by feel and by experience. And so we're using very small chisels to make these cuts. And it's a tough thing to learn, and it takes a bit of time, and it's something that we've written about extensively. So the simple takedown of the bump on the outside of the nose sounds pretty simple, but it's really a little bit more complicated than that. Then it becomes a question of how much do you want to do? As I mentioned earlier, there are some aesthetic norms that are out there that have been published about what the ideal nasal dorsum should look like. Well, unfortunately, not everyone necessarily adheres to that, and I think that's appropriate. Everyone has their own ideas about what they want their nose to look like. There may be some familial reasons or ethnic reasons why they don't want to bring it down as far as someone else, and we try to accommodate everybody. So this is an example of somebody who wanted a slight reduction of the dorsum. So we just brought it down a little bit. And as we go through these pictures, we're going to bring it down a little bit more. Another patient who wanted a little bit more taken down. She had a little bit more to start, and she wanted it to be a bit straighter. Somebody who wanted it to be essentially straight across or maybe slightly upturned coming down to the nasal tip. Again, there are no cookie cutter rhinoplasties. Another patient who we actually use computer simulations for all of these patients, but one here I'm showing again. This is what we planned, and this is what we ended up with. So we're turning up the nose a little bit more feminine, and all the way to where we actually turn up the nose probably about as much as I would do in somebody who has a very aesthetically pleasing appearance after bringing up the nose and bringing down the bump. So it's really about balance and personal preferences for some of the aesthetic maneuvers that we do.